This hearing will come to order. We meet today to review the FY 2011 budget request and the FY 2012 advance appropriations request for the Department of Veterans Affairs. Secretary Shinseki, I welcome you and your colleagues, and I thank you for appearing before our committee. I will remind my colleagues that in order to reserve time for questions, our procedure is to have opening statements by the chairman and ranking member, followed by an opening statement from the secretary. We will limit the first round of questions to 6 minutes per member, but we can have additional rounds should we need them. The FY11 discretionary budget request for the VA totals $56.9 billion, an increase of 7.4% over the FY10 enacted level. Additionally, the request includes $50.6 billion in FY12 advance appropriations for medical care. The budget submission also includes a separate supplemental request of $13.4 billion to expand Agent Orange benefits. I'm especially pleased to see that the request includes an increase of over $460 million over FY10 for the Veterans Benefits Administration to hire additional claims processors. Delays in claims processing are probably the most common complaint I hear from South Dakota vets. Mr. Secretary, I have read your testimony, and I'm happy to see that reducing the current claims backlog is your highest priority. It is my highest priority as well, and I will continue to work to provide sufficient resources to the department to increase the number of claims processors and to streamline and expedite the process. Before I turn to my ranking member, I want to commend you, Mr. Secretary, for your passion and commitment to ending homelessness among the vet population. I'm also pleased to see a continued commitment in the budget to improve mental health care among vets and to strengthen and expand rural health care. In the 4 years that I have chaired this subcommittee, we have provided a total of $427 million above what the VA requested to hire additional claims processors to reduce claims backlog. I'm pleased to see that this year's budget request reflects a significant increase over last year in funding to hire claims processors. However, the average claims time still hovers around 161 days and is expected to increase given the new decision regarding Agent Orange. I know that the task of transforming the VA is daunting, but the level of frustration that's expressed to me is growing. When can we expect to see some tangible results from the investments that we're making into the VBE claims process?
Mr. Chairman, if there is frustration to go around, I share a good bit of it. I wanted to put a little more of my attention into the claims backlog last year. Yeah. I got diverted a little bit, spent some time making sure that the 9/11 GI Bill was up and running properly, and now that it is, this year, for me and for VA, is about breaking the back in the backlog, getting to the root causes of what creates this as a never-ending challenge. Last year, we produced 977,000 decisions on claims, and then we got 1 million new claims in return. So this is a big numbers issue. Today, we have probably 11,400 claims adjudicators. And this number of workforce, good people who come to work every day, it takes a while to get them trained up, but they provide us the ability to take that average processing time from, at one point, 190 days, and we've worked our way down to about 160 days now, headed towards that 125 goal as an average. With this budget request for 2011, we have increased VBA's budget by 27%. A good portion of that, the resource initiatives they have underway, but also to add 4,000 people to the workforce. And right now, if we want to go faster, the solution is to hire more people because we lack the automation tools that should have helped us break the code some time ago. We're working on developing those tools, and I'll turn to Secretary Baker in a second to sort of give you an assessment of where we are. I will also tell you that we created 4 pilots to take this process apart and look at those pieces individually, and we intend to put them back together in a way that makes greater sense, simpler, less complex, and try to get momentum here. At the same time, we're developing these tools. This year, I think 2010, I'm happy to report that we have the resources in the right place, and we have the leadership focused on how to do this correctly.